After sitting down together, we've decided that the penile implant is the best option to restore your erections. The reason for this is that looking at all the other options, this option gives you a reliable, rigid erection that lasts for as long as you want it to, when you want to have it. During the procedure itself, we take you back to the operating room and then make a small incision in the scrotum between the penis and the scrotum. Through that incision, we can do almost everything. We put 2 cylinders that are sized to you, meaning that we determine the length of your penis outside the body and inside the body and put in a perfectly fitted cylinder to that. That gets connected to a little pump that gets put in a little pouch in the scrotum itself. That gets connected to a little reservoir. That reservoir is located over your pubic bone, kind of back by your bladder. Typically, this surgery is an outpatient surgery. What that means is that you go home the same day. You go home with a catheter and a wrap around the scrotum and the penis, and we'll teach you how to take that catheter out the next morning and how to take that wrap off. Prior to surgery, we'll have you meet with our pre-anesthesia team. They'll look over your past medical history and health history and determine if we need any additional testing. That may include controlling your diabetes, working with your cardiologist to make sure that we have all of your functional tests and everything up to date, and making sure that it's safe for you to undergo surgery. Since you're undergoing anesthesia and will be getting some pain medication, you will need to arrange for a ride or transportation from the surgery center back to your house. Before your surgery, to prevent you getting an infection, we do have every patient do an antibiotic wash and/or wipe to prevent getting an infection. Also, for some men, we may recommend doing or using a vacuum erection device to help maximize length and girth during their surgery. During your meeting with the preoperative medicine people, you will have a discussion about which medications for you to continue and which medications for you to stop. There are some blood thinners that we do want you to continue, such as a baby aspirin, but other blood thinners that will need you to stop before your surgery. You maybe have to be placed on a bridge or additional other medications to help make it safe for you to undergo surgery. In addition to that, we may have you adjust or stop some of your other medications related to either diabetes or high blood pressure on the day of or day before your surgery. All this is going to be discussed with you at your preoperative counseling meeting. To keep you safe from an anesthesia standpoint, we ask that you not eat or drink anything after midnight the night before your surgery. If you need to take some medications that you were told to take, we ask that you do that with a small sip of water in the morning before your surgery. Since this is an outpatient surgery and you're going to be going home the same day, we recommend you wear some loose-fitting clothing that's comfortable for you, as well as obviously you'll need all the standard things such as a driver's license and insurance card in order to check in. You don't need to shave before your surgery. We will shave the scrotum and trim the hair above the pubic bone at the time of your surgery when you're under anesthesia. On the day of surgery, you'll be taken to the preoperative area and checked in. Once you're checked in, they'll take you to a room and they'll go over all of your medical history again and have a discussion about which medications you've taken and stopped. After that, they'll place an IV and get you prepared for surgery. What that's going to involve is meeting with the nurses in the preoperative area, as well as I'll be meeting you there, and you have a talk with anesthesia about what's going to happen at the time of surgery. Once we're ready for surgery, we'll take you back to the operating room. There you'll lay down on the operating room table. We'll get you asleep from an anesthesia standpoint and undergo your surgery. After that, you'll wake up in the recovery area and you'll meet with the nurses and talk with them there. I'll also meet with you, and then you'll be able to go home with your ride. It's really common to feel nervous before going through a surgery. We're here to answer all your questions, and if you want to talk with a patient who's gone through the surgery, we can connect you with a patient who's gone through the surgery. What I can tell you is that the majority of our patients are nervous before going through the surgery, but that the vast majority of them are really happy after they've gone through the recovery process and are able to use the implant. If you have questions before your surgery, give our office a call at Evergreen Health Urology We're here to answer all of your questions and go through everything to make sure you feel comfortable on the day of your surgery and have all your questions answered before your surgery.